Before we watch Judith Beck demonstrate cognitive therapy, I have a few questions that I'd like to ask her about this approach. Welcome, Judy.
Thank you.
So, what is cognitive therapy?
Well, cognitive therapy is a psychotherapy that was developed by my father, Dr. Aaron Beck, in the 1960s. And it's a psychotherapy that aims to be as short-term as possible. It's very educative. We put a big premium on relapse prevention. And about half of what we do in cognitive therapy is to help people solve their problems that they're having today. And about the other half of what we do is teaching them certain skills, particularly cognitive and behavioral skills, that they need to get better.
So what is the basis of the foundation for this approach? You mentioned education. Is it like a learning theory?
Well, it is based on an information processing theory. So the theory behind cognitive therapy is that the way that people perceive their experience is more closely connected to their reaction, their emotional, behavioral, and physiological reaction than the situation itself. So one important part of cognitive therapy is identifying the thoughts that people have that then lead to a distressing or a dysfunctional reaction, and helping them to evaluate their thinking and change it so that it more closely resembles reality.
So the focus really is on thoughts and thinking. Is that how it's unique?
It's unique in that the theory underlying cognitive therapy really does put this premium on helping people change their thinking. The whole reason, though, that we want to help people change their thinking is so that they can have a lasting impact on their emotional state, on their mood, on their behavior, so they can act more adaptively and reach their goals. And particularly important with anxiety patients is that it'll have a lasting effect on their physiology.
So can you go through the steps and stages of your approach? And I believe you start with wanting to find a diagnosis?
Right. First, we do a very thorough evaluation, because the cognitive therapy treatment for one axis 2 disorder, such as depression, may be quite different from the treatment of another axis. Did I say axis 2?
You said axis 2. I think
right.
You meant 1.
I did. I meant axis 1. Sorry. The treatment for an axis 1 disorder, such as depression, has some similarities, but it is also quite different in other ways from another axis 1 disorder, such as obsessive compulsive disorder or eating disorders or substance abuse. At the beginning of treatment, we are generally socializing people to the cognitive model. So we're having them start to view their experience and their emotions through this lens of how their perceptions are influencing how they feel. We tend at the beginning of treatment to focus on the current problems people are having today, and kind of in a fairly methodical way helping them solve their problems. And oftentimes what gets in the way of solving problems are certain dysfunctional or inaccurate thinking. Toward the middle of therapy, we tend to put more of an emphasis on people's underlying beliefs, their basic understandings about themselves, their worlds, and other people. And then toward the end of treatment, we are really working toward termination, consolidating the skills patients have learned, and doing relapse prevention, so that when similar problems might come up in the future, patients know exactly what they need to do to solve them.
Now, you've mentioned relapse prevention twice. Can you talk a little bit more about that, what that means in your model?
Sure. We are not only trying to help people get well, but also stay well. And so we're actually teaching them to become their own therapists. When we use certain techniques with patients, such as identifying and modifying their thinking, we're not only doing that with patients, we're teaching them how to do it themselves.
That's where the learning and education comes in.
That's right. And we tell patients it's not enough to just come and talk for 45 or 50 minutes a week, but they're going to learn things in every session that they're then going to practice at home. And that's how we find that people get better, by making small changes in their thinking and in their behavior every day.
So that would be a big strategy and technique. Are there other ones?
Oh, there's lots. In fact, in cognitive therapy, we borrow techniques from every modality. So we obviously use a lot of cognitive and behavioral techniques, a lot of problem-solving techniques. We use biological techniques because many of our patients are on medication to begin with, or want to start on medication. Although we try to work without medication if it's indicated and if patients want to do that. We also use environmental techniques. Sometimes coming to see us once a week is only a drop in the bucket, for example, if the patient is going home and being abused every day, or if the patient is in such a deleterious work environment that it just is dragging them down every single day. We also might use Gestalt kinds of techniques or experiential kinds of techniques, especially when patients say, you know, I get what you're saying intellectually, but in my gut, I just don't believe it. Then we know we have to use more imagery techniques, psychodrama, things like that. We also, if I can mention one
Sure,
more, well,
yeah,
we use a lot of supportive techniques, a lot of good counseling skills, and we also use what look like psychodynamic type techniques, especially in developing the therapeutic relationship with Axis II patients, because we often find that they bring certain beliefs about themselves and other people to the treatment session and sometimes have negative thoughts about us therapists. And so we use the same kinds of techniques of identifying the automatic thoughts they have about the therapist or about the process of therapy, and then help them evaluate and respond to those ideas.
So the cognitive therapy, that's the lens that you look through, and then the way that you bring about change incorporates a wide variety of techniques and strategies.
Right. So it's important to understand that the therapy is not defined by certain techniques, it's defined by our understanding of patients. Not only that their thinking in certain situations leads to their emotional reaction, but we also want to take a look at what those underlying beliefs are. So patients oftentimes will have some very negative ideas about themselves, their worlds, and other people. And not with all patients, but especially with Axis II patients, it's very important to find out what happened to them historically, what happened to them as children that then led to the development of these very negative beliefs. And then we also want to find out, well, how have they coped with these negative beliefs all of their lives? What kind of behavioral strategies, coping strategies have they developed? What are some of their rules for living that may or may not have been helpful to them as children, but certainly are not universally helpful to them as adults?
So this is really a broad approach that deals with people in whatever way that they need to be dealt with, it sounds like.
That's
right.
right.
You really tailor this approach?
We do. We have to tailor it to the individual. So we take into consideration the patient's gender, age, developmental level. We get a very good grounding in their history. So we want to find out all about their psychiatric history, their medical history, educational, social, family, and so forth.
Now, there's a strong research base for your approach as well.
That's right. There are probably between 400 and 500 outcome trials that show that cognitive therapy is effective for a whole range of disorders.
What are some of them?
Well, all of the major psychiatric disorders. Now, when we have someone with severe mental illness, such as bipolar disorder or schizophrenia, we often insist that the patients be on medication as well. Although the more skilled you are as a therapist, the less likely you might be to absolutely need medication with patients. But with the severely mentally ill, of course, it's indicated. It's also very useful, and outcome trials have supported this, in the treatment of medical disorders with psychological components. So things like insomnia, overweight and obesity, fibromyalgia, chronic pain, migraine headaches, and a whole host of problems. And then for a lot of the psychological difficulties too, marital problems, couples problems, family problems, work problems.
So it seems it really works across the board.
That's what the research has shown us.
Yeah. Now, in a moment, you're going to be working with an actual client. What are you going to be looking for in this client? I mean, what's going to be important for you?
Well, the first thing I'm going to need to do is to find out what the patient's symptoms are. And so I will have had him or her fill out a Beck Depression inventory and an anxiety inventory, and we'll also get a subjective description from the patient of how he or she is feeling, especially compared to the past. So I will want to do that. The second thing that I'm going to want to do is to find out what's really important to the patient to discuss. So I will ask, what problem or problems do you want my help in solving today? And by having a very specific agenda, then we make sure to be able to cover what it is that's most important to the patient, which, by the way, may or may not be the first item that the patient comes up with. Sometimes when patients set the agenda, they'll say, oh, I want to talk about the problem at work because they've just come from work and they're very distressed by that. But instead of immediately launching into discussing that problem, I'll also ask the patient, okay, so there's a problem with work. Is there anything else you want to make sure and talk about today? So as you can see, cognitive therapy is a very collaborative process. We make decisions together on topics such as what to spend time on in the session, how to approach the problems, what kinds of follow-up things the patient might do at home.
You may have answered this question, but I'd like to, just to make it stand out a little bit more. So are you going to pay more attention to the symptoms, their story, you know, the narrative they have, their thoughts, their feelings, their behavior?
Well, I'm going to need to pay attention to all of them. So as they're discussing a problem, let's say it's a work problem.
Right.
I'm going to be finding out many different things. So I'm going to find out what is the specific problem, when is it the worst, how long has it been going on, what have they already tried to do to solve this, and so forth. So I'll collect a lot of data about the problem.
So that's some history about the problem.
That's right.
Okay.
And then I'll find out when was the problem the worst this week, or when did the patient feel the worst about the problem this week. What was the emotions that the patient experienced. When he or she experienced those emotions, what was going through his mind or her mind? What were the patient's automatic thoughts?
Oh, okay, so that's when the thoughts come in.
Right. And then I'll want to find out, well, what did the patient do?
Yeah.
And if it's an anxiety patient, especially where there's some physiological reaction. So I'll want to flesh out the cognitive model in that way. And then I'll think to myself, and I'll also collaboratively agree with the patient, where are we going to start working? Are we going to work at the problem situation level and do problem solving? Are we going to work at the automatic thought level and help the patient respond to distressing or distorted thinking? Is the patient so upset that we're going to work at the emotional regulation level and bring the patient's emotion down a little bit, maybe through distraction or speaking more conversationally, and before we get back to the problem? Are we going to work at the behavioral level? Maybe the patient would benefit from some skills training. Or maybe the patient is so anxious that we will do some relaxation training to get his physiology calmed down. So I'm going to be collecting a lot of data about the problem and then collaboratively with the patient decide where to start working. We might work at one level, we might work at all of those levels. If it's more toward the middle of treatment, we might be working more at the underlying beliefs that then gave rise to the automatic thoughts.
Okay, so you've got a lot of things that you want to make sure that you do, depending upon the stage. What do you not want to do? What do you want to be sure to avoid?
Well, I certainly want to avoid anything that would damage the therapeutic alliance. So the therapeutic alliance, I don't care what kind of psychotherapy it is probably the most important element in psychotherapy. Now, it's important and it's necessary to have a good relationship, but it's not sufficient.
Not sufficient, right.
So I want to make sure and be collaborative with the patient. I want to get feedback from the patient. I want to make sure that the patient and I are on the same page. I want to make sure that the patient is understanding what I'm trying to tell him or her. And I especially want to prepare the patient to have a better week. So I not only wanted to help him feel better in the session, but I want to think to myself and out loud with the patient. So what we've just gone over, how can that help you have a better week? What would be important for you to remember? What would be important for you to do? So I want to avoid discussion that ends in the therapy session with no follow-through.
So what will make for a good client for this approach? I mean, what does it work best for?
Well, maybe another way to say that are who are easy clients. And the clients who are easy in cognitive therapy are the clients who are easy for any kind of psychotherapy. So the ones who have a lot of internal and external resources whose lives aren't in too much chaos. The ones who are more easily socialized to treatment. So those are the easier patients. We really need to look at research to see which patients might not be as appropriate for cognitive therapy. And research really hasn't shown us that yet. It seems that most of the research shows that cognitive therapy is about as effective as other treatments for the whole variety of disorders.
And a final question is, what will make for a good session? I mean, what will be effective?
Okay, so my definition of a good session is the patient feels better by the end of the session, and the patient has a really good plan to have a better week. So the patient has learned things in session that he's not only probably going to use this week, but hopefully when problems arise a year from now or 5 years from now or 10 years from now, he'll be able to go back to his therapy notes, because we make sure that patients or therapists write down for the patients whatever they want the patient to remember. He'll be able to go back to the therapy notes and make use of the things he's already learned and put them into place with either the same problems or new problems.
Well, we're going to go now and watch you work, and I'm pretty confident that the same excitement that you showed in this interview will carry forth with the clients. Let's watch.
Thanks. Chi-Chi, it's nice to see you again.
Good to see you, too.
Even though I just saw you this morning. But I'm glad we have a second session together.
So am I.
So if this were ongoing treatment that we would be doing, I probably wouldn't have seen you for a week or so.
Right.
And the first thing I would do would be to do a mood check to see how you were feeling,
Okay.
especially compared to other weeks.
Okay.
And I'd find out what was important that happened between last session and this session that I should know about. You'd probably tell me some negative things, and then I'd ask you for positive things as
Okay.
well.
Okay.
And then the next thing we would do would be to to set the agenda. So that's
Okay.
where we'll start, if that's okay with you.
That's fine. That's fine.
So I had one idea in mind of something that might be important to talk about.
Okay.
But is there something in particular? We really covered the procrastination problem this morning, and we have
Right.
a plan for dealing with that.
Right.
Is there anything else you want to make sure and talk about?
I did want to talk a little bit more about work, even though that is a similar problem.
Okay.
I do feel that my problems with procrastination and poor time management contribute to an unnecessarily high anxiety level at work. And I
Right.
think that it's having a negative effect on my job performance, and I worry that, I every time, something happens, I immediately start this panicked thought of, oh my God, I'm going to lose my job.
Yeah.
So I think that's one thing I did want to talk a little bit more about. And then if aside from that, I mean, whatever you think is.
Let me tell you my idea, and
Okay.
feel free to say, yes, that sounds good, or
Okay.
no, that sounds terrible, I don't want to talk
Okay.
about it. During the evaluation, there was one time when you got very teary, and that was when you started to think about a relationship, a 6-year relationship you had that ended about 15 years ago.
Right.
And it sounds as if you got help at the time, but that there were certain feelings that were so painful at the time that you didn't talk a whole lot about
Right.
that relationship.
Right.
And I couldn't tell to what degree that's still distressing you, that breakup.
It goes back and forth. If I don't focus on it and don't think about it, then it's fine. And I think as time has gone on, and the fact that I'm currently in a good relationship, I think that's made a big difference.
Do you feel that when it goes back and forth, especially the back part, I guess, that your reaction is stronger than one might expect after this
Yes, I
period of
do.
time?
I do think so. I don't know why.
Well, that's why I was wondering whether it might be worth talking about that. So maybe you wouldn't have to have so much back and forth about it.
I'm not ready to do that yet.
Yeah. Thanks. So why don't we agree not to talk about it? But you know what? The other thing I was thinking that might be helpful is if we talked about your fears of talking about it.
Okay.
Is it all right if we spend maybe a couple minutes on
Sure.
that, and then you can decide whether you want to continue talking about it or not?
Sure.
So if you were to talk about it, what's the worst thing you're afraid would happen?
That I would be overwhelmed. And then I'd be stuck there.
I see.
I wouldn't be able to move past it.
And what does being stuck there mean?
stuck in just this feeling of that I haven't been able to move on from my past,
Yeah.
that I haven't forgiven myself
Oh. Okay.
for that mistake.
Yeah. So there are a couple parts to this. If you were to talk about it, you would get very emotional,
Yes.
and you're a little afraid that that emotion would just stick with you. And
Yeah, and I also think that when I talk about anything that makes me emotional or teary, it's very hard for me to get past my initial feeling and talk about it in a rational way.
right.
I find that happens a lot, and that has been an issue in relationships. I find it very difficult to talk to have a really serious conversation with somebody that I'm in a relationship with, even a friendship with, without getting carried away by emotion, whether it's
Yeah.
anger or just getting teary or whatever. It's very hard for me to do that.
Yeah.
It's very hard for me to talk about how I feel or what I want in a way that's just calm and rational.
Yeah.
I don't know why, but
Well, it's hard for a lot of people.
okay.
It sounds like it's not so much of an issue right now because Mike is away
Right,
for a while.
right, that kind of.
When he comes back, might it be an issue again?
It's an, yes, I think it is. I think it's an issue because we have very different styles of communicating, and I definitely think that there are things that we do need to talk about that neither one of us has been able to really do. I mean, I don't know if is it a problem? Somehow we've managed to, I mean, we've been together 9 years, I think. And so obviously we must be able to communicate on
Yeah.
some level. And
Well, I was wondering whether you might want to just talk about this fear you have of experiencing negative emotion. We don't need to talk about the breakup.
okay,
In fact, it might be more helpful to talk about it in the future when Mike comes and there are important
Right.
things to talk to him
right,
about.
right. I think that my fear is that I'm going to get so carried away by, and it's not just a fear, it does happen, that I get so carried away by my emotional reaction
Yeah.
that I don't really end up saying what I want to say.
Yeah.
And then I get upset with the other person for not somehow magically understanding it without me having to say
Yes.
it. And I know that that's a problem. I know it's a problem. I know it's happened over and over. But I don't see a way out of it.
I see a way out of it.
Oh,
Or I see some things that I think could help.
okay.
But I don't want to, if you want to talk about the anxiety at work.
No, this is interesting.
This feels like a little bit more central.
This is interesting,
to-
yeah. And it's, yeah.
And if we have time, we can try to save a couple minutes at the
Okay.
end for the anxiety
Okay.
at work.
Okay.
So we can either talk about something that you have tried to bring up in the past, or we could talk about something that you could imagine you will want to bring up in the future.
Right.
Which do you think would be more helpful?
Let me think for a minute. I guess we could talk about. We could talk about something that's ongoing, I guess.
Oh, that's even better.
Yeah.
So tell me about that.
Well, occasionally Mike will talk about our future together, and he'll say that he wants us to get married or live together or any of those things. And then we'll talk about it, and it seems to be a good conversation. But then the next time that I bring it up or want to say something about it, it's like we never had that previous conversation. It's gone. And so it seems like it's almost like he's responding to some you know, some sentimental feeling or some romantic feeling, and he talks about this stuff, and then, but then when I want to talk about it and want to really pin him down, it's like it never happened.
What does he say?
He just says, well, yeah, we'll talk about that later. And so that's one thing. I also feel like I haven't really conveyed to him what some of my concerns are with. I feel like he'll talk about things that he wants to see happen and is completely ignoring
Yeah.
what I'm saying. One of the big issues that we had in the past, I think it's not going to be an issue now just because of biology, is he would sometimes say that he wanted to have children, and he wanted us to have children. And he would, you know, he's a very methodical, logical person, and he would sit there with this very long methodical list and go through it, and I would be responding very emotionally, trying to
Right.
get him to see my point of view, and I would feel like he just did not hear a word I was saying.
Yeah.
That he would just keep on with his list and just talking right over me while I was just screaming at him. And so I still feel like that these issues are unresolved, and I still sometimes wonder, like, does he still think that we're going to have a child? And if so, why does he think that? And every once in a while he'll say something that indicates that he does, and I go, but again, when I try to pin him down, he just skitters away. So it feels like there's these kind of big, important issues out there that couples need to figure out that we haven't. And so I think that's, you know, that's frustrating.
Can you wait till the next time you see him in person to have a conversation with him about these things?
Yes, yeah.
And you think that would be better than on the phone?
I think so. I think so.
You know, the phone is awful hard because you can't get the nonverbal feedback.
No, you really can't. You really
way.
can't.
Yeah.
And yeah, it's.
Yeah.
And we do video conferencing, but that's not the same
exactly
either.
the same,
It's not quite the same.
And when do you see him again?
In 2 weeks.
Oh, he's coming very soon.
Yeah.
Oh, okay. So
Yeah.
this may be apropos to that time.
Yeah, yeah.
So what would you like to say to him?
I would like to say, I have tried to tell you that this idea of yours it's not going to happen, and I've tried to convey that to you, and you keep coming back at me with this, you know, methodical list of reasons why it should happen, why it can happen, and you've never heard my point of view. Or if you have, you've pretended that you didn't because it doesn't coincide with your point of view, and because if we can't agree on this, then we probably can't be together. And I actually have told him that. And he just got very upset and was like, well, you know, that's an extreme reaction. But I think he thinks that he can win me over by using logic and, you know,
Persistence.
Persistence, yes. And he just is not getting it.
Now, I wonder whether there might be another way to approach him. If he were to say something like, Mike, I have something to talk to you about that really makes me upset, but I'm going to try to talk about it in a way so that I don't get so upset. Is it all right if is this an okay time for me to talk to you about this? So you give him a little bit of the control over the time.
Right.
And then he'll probably say, well, what's it about? And you'll say
Right.
it's about having children. And then he might say, well, I don't want to talk about it now.
Yeah, that's probably what he'll
And
say.
you might say, well, let's
Right.
set a time then before you go back, because
Right.
we only have. how
We'll
much
only
time
have a
together?
few days. We'll
We'll
have
only
about a week.
A week together. So you might want to bring this up, you know, fairly soon to the
Yeah.
beginning.
Yeah.
So maybe you could set a time if he doesn't want to talk about it right then. And it might be a good idea to do this when you're out at Starbucks or someplace having coffee or something.
Right, right.
And then you might, the way that you presented it before is certainly a reasonable way to present it, except that you come across as a little bit angry and critical of him. So just another way of approaching him might be to say, I'm really confused. Because it's obvious to me that you've wanted a kid, or you've had positive feelings about having a kid for a number of years, and I haven't wanted to. And I thought that I had made that really clear, but I'm confused as to what's in your mind and whether that's still
Right.
something that you think is going to happen.
Mm-hmm.
And then, how do you think he would react if you said it that way?
I think he would probably say, what would he say? He would say, what are your reasons for that you think that you don't want to have a child?
Yeah.
Or that you don't think you can have a
See,
child?
Mike, I'm a little confused because
Right.
I feel like I've gone through all of the reasons before, and I feel like you think, gee, if Chi-Chi can't make a case for this, then we'll have a child.
Right,
And,
right.
and I have to tell you, just in my heart of hearts, I love you, Mike, and I want to stay with you, Mike. But I just don't think it's a good idea for us to have kids. And you're just not going to win me over.
Right.
And then what do you say to that?
What would he say? I don't know. He would probably say, he would probably say, well, let me hear all of the objections and I will provide a solution for each of those objections. That's his way.
Yeah.
If you say, I don't want something, I don't like something,
Yeah.
his way is to say, well, give me all of your objections and I will come up with a solution for each one.
And out of role play, Chi-Chi, do you feel like you've already done that?
Yes.
And there's just no way he's going to...
No.
And so then I think you have to say, Mike, just any amount of logic
Right.
isn't going to change my mind on this.
Right.
I'm really sorry. I mean, I
Yeah.
wish I could go along with you. I can
Right.
see that this is really important to you, and I like to make you happy, and I
Right.
wish I could do this for you. But
That would be a good way
but
to
I
phrase
really
it.
can't.
Yeah, I think that would be a more constructive way to phrase it than what I have been doing, which is to kind of, you're not listening to me. But
And what do you think he would say?
I think then he would probably hear it, and he would. I think he would hear that, and he would understand that to some level. I don't know what he would do after that. I don't know. Part of my frustration with it is that I think that he has been in long-term relationships in the past. He had 2 long-term relationships before me. My feeling is that people who want to have children do that. They know that, and they do that pretty early in their life. So why didn't that happen with those? Well, in fact, I know in one case, it was the woman who wanted to get married and have children, and he
Yeah,
didn't.
and he didn't.
So part of me wonders how much he really does want this.
Yeah.
Because I think people who do want children know it early, and they plan their lives that way.
That may be, or for any reason, but in any case,
Yeah.
I'm not sure how relevant that is
Okay.
if this is something that's so strong inside of you.
Okay.
Now, are you fearful that he may want to break up with you?
I am.
And would you tell him that? Mike, I'm really afraid you're now going to want to break up with me. And what would he say?
I don't know.
So we ought to think about whether or not you even want to have this conversation then. Because there is a risk to the conversation.
There's a very big risk.
Yeah.
There's a very big risk. I don't think he would,
But he might need to think about it.
but he might need to think about it. Yeah. I mean, I'm pretty sure he wouldn't, but you never know.
You don't know. So maybe we should talk about whether you want to have this conversation or not.
I think we have to have it because we've had all these years, together. And are we going to go along another, 8, 9 years without this being resolved?
Right. So you think you are better off just knowing one way or the other?
Yeah, I do. And I think that, and I think he needs to know. I think he needs to know because if it does mean that much to him, then he does need to,
Yeah.
Find someone that will do that.
He should actually have a rent-a-child for a little while, I think.
Before he makes that decision.
Yeah, but anyway, it's not under your control.
That part of it is out of my control.
I think we need to talk about if you have this conversation and if he decides to move on. what can you do to move on better, perhaps, than you were able to 15 years ago?
I don't know. I don't know. That's going to be really tough.
Yeah.
It's going to be really tough.
Are you in the same position in life as you were 15 years ago?
No, I think I'm in a much better position in life.
What's better now?
I'm more financially stable. I'm more, I've learned to be more independent. I've learned to be more self-sufficient. So I think I'm better in that sense.
Yeah.
Just older and wiser.
Yeah.
I know that it wouldn't kill me,
Yeah.
but
Are you afraid of that negative emotion you'll feel if it happens?
yeah, I think it's going to be pretty bad.
Yeah. Do you have a picture in your mind of what it might look like if it's really bad?
I think it's going to be pretty devastating.
Do you see yourself someplace?
It's hard to even picture it. It's at that point, I don't know. I don't know if it would be. It wouldn't. Like I said, it wouldn't kill me, but it would be. It would be very tough. It would be very tough.
When would it be the toughest?
When? Having to go through the day, go to work, pretend that everything's normal.
Yeah. And would there be anyone at work you could confide in?
There are a couple people I could confide in.
That make it better or
A couple
worse?
of colleagues. I think that would help. I think that would help at least, at least to sort of say, I might be a little strained. I mean, maybe work would be a good place to take my mind off
A
it.
distraction.
A
yeah.
distraction. It might be it might be good that way. I have. I certainly have friends that I could, get to distract me, as it
Yeah.
were.
And to give you some support?
Yes, emotional support.
really
Just,
important.
yeah. So I think in that sense, I would have more of a support network
Yeah.
than I did before. I think, I don't know. I always say that if anything happens with me and Mike, that I'll never be in another relationship again.
Mm-hmm.
So maybe that would be the way that I would handle it.
Well, what do you think about that? Do you think that's true, that you'd never be in another relationship again?
It would be really hard. It
Mm.
would be really hard to start over.
Yeah. It would be hard. There's no question
It would,
about it.
yeah. I don't know if it would be worth it.
Well, it wouldn't be worth it if you never found somebody.
Well,
Probably would be worth it if you did find somebody.
yeah. Well, it seems like I would. It seems like it would be a lot of effort for a slim to little payoff. So,
Well, why do you think the payoff would be slim?
I think it's hard to find a good relationship, and I think it takes a lot of work when you're single to find somebody good, and especially as you get older. And I wouldn't want to go through all this again.
I mean, getting more intimate, getting closer, and then getting hurt again.
Right.
Yeah. No,
Right.
of course you wouldn't want to.
Yeah.
But do you think, especially if you perhaps were seeing a therapist, that would make it easier for you to do
Yes,
that?
I think so.
Might that
yeah.
be something you would plan to do?
Probably, yeah. Yeah. I would probably have to. I would probably have to have one lined up just in case. Just in case.
Not a bad idea.
Yeah.
And you'd have your cats.
Of course.
Your cats are important
Of
to
course,
you.
they're very, very important to me.
Yeah.
And
You might have your writing. Who knows? Maybe you do some.
I might have all kinds of things that could be a good substitute.
How long do you think it would be before you kind of had your sense of equilibrium back?
Well, even in the past when I've had really bad breakups, I think I always spent, it's hard for me to remember, but it seems to me looking back that I always spent a short time of feeling just absolutely terrible and just wanting to die, and then but that feeling passed pretty quickly,
Yeah.
and then you know you have to move on. I don't know. It's hard to say. It's hard to say.
Maybe you find a Mike-like person who either has kids or they're grown or doesn't want kids.
Right.
Or whatever.
It's possible. Yes. Yeah. Or he could decide that,
He wants to stay.
that he wants to stay.
Yeah. Yeah.
Any of those things are possible. But I feel like, see, I've had very bad judgment about men always. So I feel like even just being able to find Mike was such a stroke of luck for me that I don't see that repeating again.
Oh, that's interesting. Well, what was it that drew you to Mike?
We started off as friends, and he was completely different from anyone else I'd ever been with. And in fact, I remember saying that to a friend of mine, and she said, her response was, "I like him already."
Oh, nice. So she recognized how important that was. So something changed in you. You saw something different in him.
Yeah. Yeah.
And apparently you must had some kind of equation like this, even without your friend telling you. But this new thing is good.
Yeah.
But
Yeah.
are you afraid you'll just lose that judgment?
Well, I don't know. I mean, how come I never had it I don't know what changed to make it. I'm not sure what that.
Well, it sounds like to me that Mike is different from the other guys. And so in what ways is he different?
He's very, being in a relationship with him is very, it's very calm, it's soothing, it's, I mean, that sounds boring, but it's not.
No, I understand.
He's reliable, he's predictable in some ways, he's serious, he's he's very caring he's actively caring. Like I said, he's the type that if you have a problem, he will figure out some way to fix it, whatever it is.
Are you thinking you would not pick this up about another guy?
I don't know.
You'd not be able to tell whether another guy was calm, soothing, reliable, predictable, actively caring?
I don't know. I never did before. All my past relationships tended to be pretty chaotic.
Yeah.
Guys that were kind of wild and cheated on me and were, drank too much and couldn't hold down a job. All those.
Are you giving yourself enough credit here, Chi-Chi? You think you wouldn't tell the difference between calm, soothing, reliable, predictable, and wild, cheating type drinks too much?
I think I would tell the.
I think you would tell the difference too.
But I'm afraid that somehow whatever was working at that point.
Now, do you have a safety net? Someone you could bounce this guy off of?
Probably. Oh yeah. Sure.
Like who?
Friends.
Friends. Or if you're seeing a therapist.
Or a therapist. Yeah.
Yeah. So you wouldn't have to 100% rely on yourself.
Right.
No, my guess is you've probably developed this gut sense now.
Maybe. It took me a long time, though.
It did take you a long time. But sometimes once you get that learning, it just takes hold.
It's true. I mean, sometimes I think, sometimes I think about Mike and I think, God, I could never go back to those bad guys again after this. I would never tolerate it,
Chi-Chi, we've just talked about so many important things.
I know.
No, I just think we should probably get some of them down in writing.
Okay,
Do you want to write or you want me to?
Whatever you think is better.
Doesn't matter.
Okay.
Or we could both do it if you want. Doesn't
Okay.
matter.
Okay.
So let's see. Do you want to just start or do you want me to ask you a question to start?
If you can start. If
Okay.
you can start. Yeah.
So we talked about having a discussion with Mike.
Mm-hmm.
And so do you want to write down something about what that discussion should
Yeah,
look like?
yeah, that would help me, I think, yeah.
What should we say?
I'm trying to remember how we had phrased it. Setting up a time to talk.
Yeah.
Because almost guaranteed he'll say, this is not a good time.
Yeah.
So making sure that we set aside a time to talk. I would probably have to let him know that it won't be, a long, drawn-out period of time.
Oh, that's very good. So I wanted something
yeah.
to talk. Maybe we could talk for about 20 minutes about it or
Right,
something
right.
like
That
that.
it won't be a
that's
long,
great.
drawn-out.
Now, I don't know if this helps, but I'd use the word confused. I'm confused, Mike.
I think that
that-
would be a good way to phrase it.
Confused.
Because then it's not like I'm saying that I'm angry or I'm hurt or just confused.
And another thing we talked about was saying, I'm so sorry that we want two different things
Right.
here.
Right.
And then, I would give it to you if I could.
And I would. I mean,
Yeah. And we talked about if he insists of saying, again, I'm confused, we've already been through this isn't
Right,
going to work.
right.
I imagine if he keeps on insisting that you may have to go along with him and say, okay, I'm willing to do this one last time.
right.
And then at the end, I have to tell you what my conclusion is.
Yeah.
Insists, confused, we've been through this. But compromise if you need to.
Mm-hmm.
One last time.
Right.
Is there anything else that you want to have in this conversation with Mike?
That I think that's, that I do want to stay with him.
Oh, absolutely.
But that this is just not something that I can do.
Yeah,
If there were any way to do it, I would, but.
yeah. Okay.
Yeah, I hope I can do all this without.
Well, then, if you think you can't, then I think you have to say to him, I'm going to try to do this without crying. I'm going to try my hardest. I know it's really important to you that I not cry. If he's like most men, he's
Right.
going to say, but I might, but I'm going to try to, I
Right.
want you to know that I'm going to try to control it as much as I
Right.
can.
Right.
Okay. I think most women would find it extremely difficult to have this conversation without crying, so you're in good company if you cry. Then the next thing we talked about is if he breaks up, if he
Right.
decides to break up with you. So if we break up, and what do you think would be important for you to remember?
That I have a support system, that I can get through it.
Yeah.
That I'll have to slash his tires on his car. No! I just-
You could just key it. Key. Get through it. Another thing we talked about was that the intense emotion is short term.
Right. Right. As I recall, people who were there with me might remember it differently.
Well, usually it
but
kind of
that's- Right.
comes and goes, but most of us can't maintain emotional
No.
intensity for
Right.
a long period of time. We said that work could be a distraction.
Friends, therapy.
Yep. Friends, therapy. And we also talked, if we break up, that you'd have a choice then, that you might at some point find somebody else.
Yeah. I can't really think about that part of it.
So maybe we should say something like, could talk to a therapist
Yeah.
about a new relationship. Doesn't mean that you're obligated to.
Right.
But we also talked about how your judgment is much different from how it used to be.
I hope so.
I better put judgment maybe,
Maybe better than it used to be.
maybe better. I don't think you had a role model like Mike before to compare guys to, or did you? I don't know.
My father is somewhat similar, was somewhat similar.
Although usually you don't want to compare our
I
relationships
know.
to dads.
Yeah, I know that sounds creepy, right? But
No, if it works, it works. That's fine. That's fine. But it's a natural thing that, not to gravitate toward
right,
initially.
right.
So Jennifer may be better and can get, I'm going to say, advice from friends,
Therapist.
therapists.
Yeah.
That's good.
Yeah. So.
We also, one of the things we started to talk about a little bit is too that you could enrich your life in other ways.
Yes, that's
In fact, the other ways that we were talked about this morning.
that we already talked about. Right.
We talked about this morning.
And I think that makes a big difference also,
Yeah.
because those would be distractions, but healthy distractions as opposed to some of the others.
Did you want to talk about this anymore, or we have a couple minutes left to talk about work? If you'd
Whatever you
rather.
think is there.
I don't know. Do you have your sense? What's your gut say about?
I feel like this has been a very good. I think we've handled this one for now in a good way.
Maybe
in
we
a good
could
way.
talk about work and apply some of the things that we talked about here to work.
Right.
Okay. So a typical situation is you're at work, and then what makes you have the thought, what if I lose my job?
If I feel like there's something coming up, something I have to have done that I'm behind on, and I'm scrambling to get it done, and my boss is asking me when I think I'm going to have it done, and I always do get it finished, but in doing so, I've created all this anxiety for myself, and I feel like I'm in a panic state, and I feel like I'm forgetting some important piece of it.
Yeah.
So I seem like I just caused myself all this unnecessary panic and worry, and we have had layoffs at work. So, everyone is just kind of hanging on.
Yeah.
And
Okay, so the first thing I want to point out to you is the reason that you feel anxious is because of what's going through your mind. You could have the same situation at work, behind, scrambling, bosses asking me when you're going to get the project done. And if you had the thought, well, he's a little anxious himself, but I've always gotten, or she, I'm sorry.
It's all right.
I've always gotten my projects done in
Right.
the past. Even if I screw up this one, so it's 1 out of 50, then I haven't gotten done, I'll probably be okay. If you had those thoughts, then what would your anxiety be like?
it would be a lot less.
Be a lot less.
Yeah.
So our emotions are influenced by what we think, by our perception of the situation. And when we're anxious, sometimes our thinking is realistic, and sometimes it's not.
Okay.
So one of the questions, I'm going to teach you 2 sets of questions. Okay. One set of questions has to do with just looking for the validity of your thoughts. So what's the evidence that if you don't meet a deadline, that you would lose your job? Is there some evidence? Has your boss said things before?
Not so much about that, but no, I mean, let me think. My boss, I have 2 bosses, and the big boss, I guess.
Yeah.
I know it's frustrating to her that she's an extremely organized person,
Right.
very orderly, very organized, very that way. And I know it's frustrating to her that I'm not.
Right.
There's someone else in the office that's the same way, and I know she feels that way about both of us.
Yeah.
And, she wants things done a certain way, which I understand. But I always feel like when she expresses her frustration with me about those things, she doesn't do it in a, she doesn't get angry, she doesn't yell or scream. She presents it in a way that she wants me to be better, and she
Yeah,
wants
she's not happy about it.
she's not happy about it.
Yeah. Now, would the happiness, the unhappiness, go to the extreme of firing you, do you think?
I think if it kept up, and well, I think it would be, I would have to screw up pretty badly
Yeah.
to get fired.
And when you're at work and you're behind and you're scrambling,
Mm-hmm.
would this be a major screw up?
No, I mean, as long as I get it done
Yeah.
and get it done properly and on by the deadline, no.
And well, what if it wasn't by the deadline?
Then that would be a pretty big screw up.
And she would fire you then?
No, I would probably get a warning or be put on probation or something
Right.
like that.
Right. In which case, you could use the skills we talked about this morning to get yourself to beat the deadlines better.
Yes, exactly.
You know what we
exactly.
didn't talk about it. In fact, what just as an aside, a problem-solving thing might be to set yourself earlier deadlines than your actual deadlines.
Yeah.
So
yeah.
that may help.
Okay.
Okay. So, so you screw up badly once. Chances are she wouldn't fire you, but she wouldn't be happy about it. Is there any evidence on the other side that you could screw up and not get fired?
Yeah, I think.
Have other people screwed up? Have you screwed up
Yeah,
and not
yeah.
gotten fired?
I mean, yeah, definitely, definitely there are. Yeah, this other woman in the office that I was talking about, she was telling me that she was worried about her evaluation that's coming up because even though she does a really good job, she can never get to work on time. She's always like an hour late.
Yeah.
And she said, you know, our boss, she said she keeps bringing this up every time we have an evaluation, and you know, she keeps saying, can you please,
Yeah.
please just get here.
But she's never
on
gotten
time."
fired for it.
But she's never gotten fired for it.
Yeah.
You know,
So maybe there's a little more leeway than,
there might be a little more
than it
than
feels.
I think. Yeah.
The other thing to remember, I think, is that you're a known quantity to your boss.
Right.
And anyone that she would have to hire would not be a known quantity unless it's somebody
That she knows.
she knows, or
Right, right.
raising within the
Right.
organization. And if she
Right.
likes things neat and orderly, she might
Right.
not like starting over with somebody.
With somebody new. Well, that's true.
Okay, so
That's
the first
true.
question when you're making a negative prediction like that is, what's the evidence that this thought is true? And is there
Right.
any evidence on the other side that maybe it's not true?
Right.
Then the second set of questions are what we call the decatastrophizing questions, making things less of a catastrophe. So if the worst happened and you lost your job, how would you cope with that?
I would take all the practical steps of making sure that I got unemployment and my insurance continued and so on.
Yeah.
I've been fired from jobs, so I know.
And you found other jobs.
So I know what to do.
Okay, so that's a known quantity too.
To do quantities, yeah.
So you'd be able to cope. You know the steps. That you
Yeah,
need to
this
take.
economy is a lot tougher.
It is. So
And
it
I'm
might take
older,
longer.
And
Yeah.
and I'm older, so I can't be
But-
quite
but-
that cavalier
But
about
you'd
it.
survive.
Somehow I
in
would.
the probably unlikely chance that,
Right.
that you got
Somehow I
fired.
would.
But so that's the worst, and usually our minds gravitate toward the worst.
Yeah.
What's the best that could happen in this situation?
I could use my set of steps that we worked out here and do such a great job that my boss would be amazed at how
Yes.
much better I was doing.
Either that, or that you'd get a new job that you liked even better.
That would be, yeah,
either one of those would be the best. And what do you think is the most realistic outcome?
probably the first one. I think getting another job would be,
I'm sorry, just the whole most realistic outcome if you're at work, you're behind and you're scrambling.
oh,
What's the most realistic outcome? That you would get it done in time?
that I would get it done on time, and that I would be safe another day, I
You'd be
guess.
safe another day, or another year,
or another month, or
whatever.
whatever. Yeah,
Yeah,
yeah.
So
Yeah.
when you're feeling really anxious, you want to look for these negative predictions that you're making.
Mm-hmm.
And you want to ask yourself, well, what's the evidence that this negative prediction is likely to come true?
Right.
Is there any evidence on the other side that maybe it's not likely to come true?
Mm-hmm.
And then ask yourself, okay, if it did come true, if the worst did happen, how would I cope?
Right.
But that's just the worst outcome. What's the best thing that could happen in this situation? And then what's the most realistic outcome? And I think if you practice this, you may need a little help with a therapist, or you may
Yeah.
be able to do it on your own,
Yeah.
then I think you'll find that your anxiety starts to come down.
Right, right.
And we use similar questions actually with Mike. What's the evidence that he would leave you or not leave you? What's the evidence that you would or wouldn't be able to find somebody else? If
Right.
the worst happened, how would you cope? Or what's the best and the most realistic scenarios?
That's true. I hadn't, yeah, but yeah.
So, so these questions work for any
That's
sense
interesting.
of anxiety.
That's really
that you
interesting.
have.
It's, yeah.
So what did you think about our second session together?
I thought it was really good. I mean, I feel like I liked the ability to talk about things that are very deeply emotional and upsetting, but in a way that it seems like this way that you have of breaking things down is very, it makes everything seem smaller and much more manageable than it is.
That's exactly right. That's what we aim for.
Because it feels, I felt like I came in, and the first session also with, just these enormous things that were just so huge and blocking, and that after talking with you, it's like, well, those are not really big deals. What's the big deal?
Well, they're big
And-
deals unless you have the tools for them.
Right.
Like the
yeah.
rubbing alcohol for the ink on
Right,
fingers, right?
right. It would be a big deal for you to have that stain on your hand all day,
That's
but
right.
now you don't
But once
have
you have
to.
the right tools,
Right.
and so here are just a couple of
Yeah,
tools we went over
they
today.
just seem like they're so much more manageable and
Good.
small, and not, and also that they're not the center of my life. That that there are other important things going on. That
Would you feel like you have more going for you?
yeah,
In a
that I'm
way.
not such a big loser.
No, of course not. Of course not. Oh, another one of those automatic thoughts.
Right.
What's the evidence for that? There's a lot of evidence against that.
Right.
Gigi, I'm so glad we had the chance
I'm
to
so
talk.
glad also. Thank you so much.
Sure.
Thank you so much.